Hey everyone, welcome in. We are so glad to have you today for another great AOSH webinar. We are certainly glad to have you here with us. While you are jumping on and joining us today, if you will in the chat, tell us where you're from, who you are, all those great things that we want to know about you. If you want to give a shout out to your dentist office or to your medical office, wherever you work, if you'd like to do that, please do so over in the chat. We love seeing who you are and where you're from. We'll give you a shout back. There's nothing as good as doing a shout out for the folks that you work for. We are so glad to see you. I am not in Tennessee today. I'm actually sitting in the Dallas Fort Worth airport right now, trying to get back home to Nashville, Tennessee. So we are certainly happy to have a few minutes with you. I am not going to stay on today. I'm going to leave you in the capable hands of Danielle Springfield, our senior digital marketing coordinator, whose title needs to change because that's just way too many words. We need to just give her a promotion and move her on up and change her tie a little bit. But hi, Sherry, welcome in from Arizona. Great to see you. Kathy from Berkeley Life. Hey, welcome in. It's great to see there are folks coming in from Berkeley Life. The guys, as you're coming in, if you'll give a quick shout out to where you're from, we'll get started here around 12:04, 12:05, somewhere in that general vicinity. Lisa, welcome in from San Antonio. You're down in the Texas area too. I'm not going to be here much longer. My flight leaves at 1, so we're gonna we're hopefully going to roll out of here. Excuse me, you all. I'm still trying to recover from my bout with our friendly disease known as COVID. So we're hanging in there, but we're going to make it. So, guys, as you're coming in, tell us where you're from. While we are hearing our great presentation today from Dr. Vickery, use the emojis, ask questions, chat with each other. We love to see the emojis used for everybody to use the cheers, the claps, the hearts. It helps our speaker know that you're listening and that you're engaged and you're involved. And we always love to see that. So when you use those emojis, it's just kind of a boost. I know I gave a couple. I've done a couple of lives in the past few days, and it always feels good to see people doing the cheers and the claps and everything, and it just makes you feel better. Nikki, welcome in from the University of Tennessee Health Sciences Center, one of our great allied partners. It's always great to see you guys in here and join with us. Nikki, we are a big fan of Dr. Walla Wasson down in your neck of the woods. She is one of our advisory board members, and we always love to see that. Hi, Angela from Dallas, Texas. I'm sitting in Dallas right now, so it's great to see you. Stephen from Warwick, UK. Welcome in from
Wow.
UK. Great to see you. Nikki, welcome in. We're glad to see you as well. So I'm going to make a real quick announcement and then I'm going to pop off here. And I want to say about annual sessions. So I didn't come down to Dallas for annual sessions. I'm actually here for our spring. I came down here as a hosted buyer to try to help figure out where AOSH is going to be for 2027. So we hopefully will be able to make an announcement before we go to annual sessions, to be able to tell you where AOSH is going to hold our show for 2026. We're definitely going to be able to do that. That announcement will probably come in June. And then by the time that we get to annual sessions, we'll actually be able to tell you where we're going to be by 2027 as well. Welcome, Hannah. I see you in here with us. We're glad to have you. We really, I cannot emphasize this point enough to you. Guys, we're down to getting into the 30, 40 counts on tickets for annual sessions. We don't have that many left. If you have not bought your ticket, please do so. We're going to have some disappointment, and I don't want that to be the case. I want to see all of you with us in Dallas. Please get your ticket if you haven't done so. If you have, hi, Becky from Memphis. We're so glad to see you. If you haven't gotten your ticket yet, please do so as soon as you can. Um, we can't emphasize enough that these tickets now are because it's getting closer to the session. They're selling a lot faster. I think we sold 2 or 3 yesterday, just yesterday alone. So they are. Hi, Hope. Welcome in from Texas. We know they're going to go fast. So you've really got to do it. The good news is, I know a lot of people have been concerned about the hotel being full at the Cooper and then going over to the Lincoln Center Park and not having the Hilton, not having shuttle. Don't worry about that. We have a contract on a shuttle. So, and it's a big shuttle. It's not going to be, it's wheels on the bus go round and around school bus. It's a big shuttle. So you're going to have a big shuttle to get you where you need to go. So we have that. You're not going to have to worry about that. We are going to take care of you. You are family. And because you're family, we're going to love on you like family. So you're going to be okay. We're going to take care of you. So do not panic. Everything's going to be okay. We're going to take care of you. So get your ticket to annual session. At this point, I'm going to step off because I don't want the noise from the airport to distract from what the good work that's about to happen here today. We love you all. We appreciate you. Danielle, I'm handing this over to you. You guys have fun. Enjoy this. Dr. Vickery's going to knock your socks off with what he's going to present to you today about nitric oxide and all the great things that it does for your cardiovascular health and your overall health. Hannah, you guys, thank you so much for your partnership. We love Berkeley Life. We absolutely love you. We are so grateful for you. If you guys don't know about Berkeley Life today, you're going to learn a lot about what they do and their great product. And we absolutely love you guys. Thank you so much for your support. Goodbye. I'll see you when I get back to Nashville, y'all. Take care.
Bye. Thank you, Violet.
Absolutely.
All right. Hi. Hello, everybody. I'm Danielle. I'll be your host today. I'm being joined by the wonderful Dr. Vickery, who will present just a moment. But real quick, I just wanted to say for those that are here for CE, you have a couple of rules you have to follow. I'm sure you've heard it before. You have to attend at least 90 minutes of the webinar, which is usually about 50 minutes. You have to be an AAOSH member to have it on your transcript, and you have to fill out this form. We're going to be giving you a link and a little QR code at the very end. You'll have to fill that out just to let us know that you want to CE. Okay. So I'm going to share my screen for a few minutes and introduce everything, and I will pass on this. So today's webinar, thank you all for joining us, will be called The Measurable Protocols for a Foundation of Total Health. Dr. Vickery has no conflicts of interest, but he is affiliated with, these are just disclosure of unlabeled use, disclaimer, course description, which is on the website and will be on further text, the objectives that the doctor will get into today, as well as applications. All right, so our wonderful doctor is a board-certified family physician, author, and founder of Authentic Health in Asheville, North Carolina. A passionate advocate for personalized holistic medicine, Dr. Vickery is known for helping patients uncover the root causes of illness and empowering them to take control of their health with evidence-based lifestyle planification. Since founding his practice in 2005, he has integrated principles of behavioral science, brain health, nutrition, movement, and sleep into his clinical approach. Dr. Vickery also teaches medical students and residents from UNC Chapel Hill and East Carolina University and remains committed to advancing healthcare access and innovation through initiatives like Synergy Health Solutions. When he's not caring for his patients, he enjoys exploring the outdoors with his wife, Kelly, and their 3 children. We're absolutely thrilled to have him today, and we are very much looking forward to the wonderful insights that he can show us, and I will pass on him to share his screen.
Thank you very much. Can you hear me okay? Is the sound okay?
I can hear you okay.
Good.
Anyone
All right.
in the chat?
Yeah, thank you. I was really excited when I was contacted by Berkeley Life about this webinar, about with the fact that this is for professionals in oral and systemic medicine. I'm sure that you all feel the same, but for me, coming up from a family practice background, it was so crystal clear all along to me how the health of the mouth, specifically, the dentition, the periodontal areas, all functions of the mouth, how critical they were and intertwined they were with our systemic health. And now we have, of course, an enormous amount of research validating that point. And anything that we can do to reduce the compartmentalization of oral health from systemic health, I think is really important, because at the end of the day, it's all the same thing in terms of how our bodies stay healthy, how we age well, how we reduce our risk of disease. So I'm really excited to present with you guys today. Just a little bit about me, and then we're going to jump into the meat of the presentation. I'm a family medicine physician. I started a medical practice in Asheville, North Carolina, where I still live, about 21 years ago when I finished my residency. And at the time, it was just me and a couple of staff. And back then, we still went to the hospital. So I was taking care of the patients in the clinic, but then rounding them in the hospital and doing overnight call shifts in the emergency department and taking care of people in the ICU, and got an enormous amount of experience taking care of a lot of people in different contexts. And I learned a lot from that. Of course, over the time that I continued to evolve my learning, understanding, and see more patients, I really became puzzled. This is, in the earlier 2000s, by how sick patients were who were coming to see me. It didn't make sense to me that 40-year-olds already had 4 or 5 chronic diseases that we needed to manage with medications. It did not make sense to me that 30-year-olds were coming in, and while maybe they didn't have a diagnosis, their experience of health was not good, whether it was migraines, fibromyalgia, anxiety, sleep disturbances, mood disturbances, chronic fatigue. It was clear that our population wasn't doing well, and that the toolbox that I had at that time was not sufficient to actually help me manage a population of people into a state of better health and reducing disease. And so that was where I began to really dig in and go back and study nutritional biochemistry and genetics and all the other things that we can study to better understand human design and human health. And then begin to introduce what I was learning into my practice, just the regular flow of a family medicine clinic. And that could be teaching on lifestyle, or it could be unique molecules or therapeutics that had potential benefits, or peptides and other such things. And of course, did see that this was really impactful, and that the people coming to see me did not want to be sick. They didn't want just more prescriptions, although a lot of times that's what I heard from others, is that people just want prescriptions. They don't want answers. I learned that they wanted answers, and that if they were presented with information and options that they trusted and could have some confidence in, they would do it, and that we would see these improvements in health, and we would see diseases go into remission, and we would see overall well-being improve. So that became the thrust of my practice, which is still what I do today. At this point, though, I'm fortunate that I can get a lot of data on the patients I see, including body composition analysis, genetic reports, toxicant reports, gut reports, cell membrane reports, metabolomics testing. And so it's a data-rich model where I really get an enormous amount of information about the state of a human being who comes to see me. And of course, what I see is alarming at baseline in most individuals. And I do try to get all of my patients to also work with a holistic dentist to begin to possibly assess their oral biome and the health of their mouth and their periodontal areas, and to take ownership of that, and not assume that if they can chew food and swallow that they're doing okay. And as you can imagine, just like with the gut biome, we typically see significant disruptions in that oral biome as well. So anyway, that's kind of the history of how I came, to this point. And what we're going to talk about today is the conversation centers around a molecule, nitric oxide, that you may be aware of. If you're not, then you do need to be aware of, regardless of what aspect of health you work in, nitric oxide is impacting the health of the people you coach or counsel with or care for in your clinics, or you as an individual as well. So back in 1998, there was a Nobel Prize awarded for the discovery of nitric oxide. And at the time, the understanding was it's a signaling molecule that plays an important role in cardiovascular health. As you'll learn, it does a whole lot more than just that. The way we're going to do this is I'm going to give you some kind of general background information about what I typically see going on in human systems when I'm evaluating and treating patients, and then what are the tools that we can use to get those systems to orient back to health, to healthy homeostasis, and out of the dysfunctional homeostatic state that they've actually arrived in. So we're going to look at it from a general lens. I'm going to show a few quick case studies that demonstrate the impact of addressing things like nitric oxide across domains of inflammation, vascular health, and others. And then we're going to move into a practical model of what does it look like to actually address this molecule in your own patients and in your own clinics. And then there'll be time for questions as well. Now I'm trying to advance my slide. Let me see. There we go. We've already talked about our collective goal, learning objectives. I'm skipping ahead. So the first thing that I typically present is around, what's involved in a body being able to repair itself and heal itself. Our bodies generally orient to health. We're self-healing, self-regenerating beings if we have the actual tools, the resources in our body that's needed for that to happen. And then, of course, there's the impact of all the various stressors to our human system, not just, say, emotional stressors or sleep deprivation, but also toxicants in food and many other exposures that are affecting our health, that are deteriorating our health. So there's a side of it where there's a lot of good information our body needs to stay healthy and function well. And if it has that good information, it's really robust and a resilient system. But there's also bad information that's coming in that we need to minimize in order for that system to be well. And so, thinking about these various domains, and this is not meant to be comprehensive because there are other variables or domains of health you could look at, but, arterial health, the ability to deliver blood, endothelial function, microcirculation, clearly critical for a body not only to stay alive, but to be able to heal itself. Bone marrow. Most people don't think about our bone marrow, but our bone marrow is the source of our self-regenerating tissue, and it deteriorates with age. And so having a healthy bone marrow and having stem cell availability is critical for healthy aging and being able to repair areas of tissue damage in any particular organ system. Our immune system, its ability to carry out its functions and survey the body and deal with both intrinsic and extrinsic threats. And then metabolic health and our energy balance. So this gets, of course, into the minimization and prevention of insulin resistance, diabetes, inabilities to distribute and utilize energy effectively. And the availability of our endogenous antioxidants, the things that our body was designed to produce to actually neutralize the damage associated with a lot of the bad information we get exposed to. So this includes molecules like glutathione and nitric oxide. It also includes enzyme systems like catalase, thyroidoxin, and superoxide. And they work together in like a symphony. Like they're all interdependent on one another. And to the extent that we maintain a healthy endogenous antioxidant system that can function well, our bodies will perform much better, and they will handle insults much better, and they will heal faster. And the problem is that with age and with nutritional deficiencies and insufficiencies, which are a population level problem right now, our ability to maintain healthy levels of these endogenous antioxidants is compromised. And that's playing a big role in chronic disease and accelerated aging and just poor health in general. And so one of the things you're going to learn is that while we don't necessarily have a lot of research-backed mechanisms to necessarily improve catalase or superoxide or thyroidoxin, that nitric oxide and glutathione are like the two heavy lifters in this system. And we actually can modulate those in the patients that we care for. Nutrient availability. The body is all of your cells and all of your tissues built out of those cells are basically the structure and function is dependent upon essential macro and micronutrients, essential amino acids, essential fatty acids, phospholipids, vitamins, and minerals. And in a clinic like mine, where we've been able to survey thousands of people with comprehensive intracellular nutrient evaluations, what we learn is that the average person is walking around nutritionally insufficient, which means the actual molecules needed to maintain structure and function are not present, which means the system isn't going to do well. And then we get into cell membranes, mitochondrial function, and there's more, right? So there's all these different ways that when you're thinking about whether it's the health of the mouth or the health of the kidney or the health of the heart or the health of the brain, these are the foundational variables influencing the function of those systems. And everything that I've listed here, nitric oxide has an influence on. meaning it directly affects endothelial function, arterial health. It affects the health of our bone marrow. It's absolutely critical in immune system function, and it makes a difference in every other thing that I've listed here. So this is a really important topic that we actually have a pretty easy pathway to impact, to do something about. What does it look like if you have impaired microcirculation or macrocirculation? Well, you can read the list here, and I think you probably already know this. So it can lead to obviously sexual dysfunction, metabolic dysregulation, thinning of the bones, gut axis disruption, shifts in mood, immune system impairment, detox impairment, increasing skin damage and skin aging associated with UV exposure, and the list goes on, right? So we know how critical it is that we maintain a healthy circulatory system and can deliver blood effectively to all of our tissues. And then I've already, in one way, I've kind of mentioned this indirectly. So, the average human system, the average individual who it maybe is not even diagnosed with any conditions, who comes into my clinic where I have all of this data and all these tools to assess them, what I'll typically find at baseline is that they do have depleted nitric oxide capacities, and they do have endothelial dysfunction and microcirculation dysfunction, and they are likely at risk of developing arterial plaques over time. Most of them have some degree of insulin resistance. Most of them don't have an optimal body composition. Most of them have clear markers of elevated oxidative stress and chronic inflammation, which is affecting all these systems we've talked about. Most of them are depleted in glutathione, primarily because the toxicant burden their body is dealing with on a daily basis is basically saturating glutathione ability, like production. And then most of them are nutrient insufficient and deficient. Universally, people will have some degree of gut dysbiosis and gut integrity compromise, and most have measurable high levels of mycotoxins and heavy metals, and also various envirotoxins. And then, of course, there's a lot more to it. We can look at their stress through heart rate variability, their sleep scores, and hormones, and we see all kinds of dysfunction. So the bottom line is that, at least if my observations across thousands of people are reflective of our population, then our fellow human beings, we're not doing well. We're not aging well. Our children aren't developing well. We're missing out on a lot of our health potential, which is limiting our potential. So, a lot of the people on this call may be very specialized in oral health, but they're obviously interested in systemic health as well. And I might end up speaking on any one of these systems: mitochondrial function, cell membranes, glutathione, detox. In this particular talk, we're focused on nitric oxide because it really does take a lot of time and to restore and optimize a human system, to take a system that, as I just described, address all those areas of those domains of health, and put together protocols and have that individual begin to restore and optimize these domains of health. Right? That takes a long time, and there's a lot of work to be done. But there's one thing that's pretty easy to do that makes a big difference in every one of those categories, which is to simply assess nitric oxide availability and intervene and optimize that if it's not as it should be. And so it's not the only strategy that should be used, but it's a powerful one, and it certainly shouldn't be neglected, given how critical this molecule is for many aspects of system function. And then, things to keep in mind that I think I've already said this: the average person you're seeing probably has health conditions, or if they haven't been diagnosed, but they went through a more deep assessment, would find out that they're not as healthy as they thought or hoped. The time and resources need to re-optimize their human system. Sometimes they're often not available, especially in a specialty clinic, but there are opportunities to leverage foundational variables that can impact across these domains. The resources we're talking about today can only help. They cannot harm a person. And even if you can't solve their primary problem that you're trying to address, you might be able to improve it, but maybe you can't solve it. When you address a keystone molecule like nitric oxide in a human system, they're still going to feel better. They're still going to be healthier. And then people who are feeling better and are, are generally not as bothered by some of the things that they have to live with. So that's the background on essentially what we're seeing. And also, if you take what I listed there and you go just look into the population health literature right now, where they study these different domains of health in populations, you'll see that the population health literature supports my observations in my clinic. As a population, things aren't going well. Now, this first case study has to do with immune dysfunction and inflammation. This was a few years ago. It's a healthy 50-year-old female. She established care for me primarily around health optimization. She's athletic. She came in and, what I had seen on her blood work were sort of an interesting cluster of inflammatory markers and oxidative stress markers that were a little bit discordant with the rest of her health picture. And upon interviewing, she acknowledged that several months earlier, after she had had COVID, and this was during the, I think, Delta strain of COVID, that she had not really felt the same sense. Her exertional capacity was reduced. She was more tired. It took her longer to wake up. She wasn't able to focus, but because she was generally healthy and felt good, she was just sort of accepting this. So we did the full evaluation on her. There was more to it than what I'm pointing out here, but I'm pointing out key variables that tie into those specific complaints: chronic inflammation, post-COVID chronic inflammation. So we saw that she had elevations in C-reactive protein, interleukin-6, which is an inflammatory cytokine, and fibrinogen, which is a marker more related to clotting, but is often elevated in active inflammation, especially vascular inflammation. Now, the way we look at nitric oxide availability is multifactorial, because we can't actually measure nitric oxide in a human system. It's metabolized so quickly. So we don't have accurate ways of doing that. So we have to basically infer some things. So what we can do is a salivary test, and we'll talk about this again later, to see whether or not that person has optimal levels of nitrites, which is one basis for nitric oxide production. Your nitric oxide is produced in a couple ways in the human system. One pathway is what are called the nitric oxide synthase enzymes, NOS. And the NOS enzymes will use arginine, and they're ultimately taking the nitrogen from arginine and go through a series of reactions and ultimately produce nitric oxide. Now, as we age, depending on our genetics, you can actually look at the genetics for NOS. Are they optimal? Are they possibly sluggish? And we do look at that in our patients, because that goes into our equation of when to intervene with nitric oxide. But if somebody if somebody at a particular age, then they're going to have a likelihood of their NOS system not working as efficiently. So by 50, you're going to, close to half of the people, they're not going to be creating adequate nitric oxide through the NOS system. So a very common thing for men, especially around 50, to show up at their physician's office for a checkup and have borderline blood pressure, or possibly stage 1 hypertension, and also to mention that sexual function isn't as good as it used to be. Well, those are signs of endothelial dysfunction, right? The endothelium is not working as well as it used to. Blood delivery is compromised. And a lot of the times what that really means, if they're not a smoker, they're not a diabetic, they don't have a lot of other health challenges, is that their nitric oxide production has finally fallen off and they're not able to sustain those levels. Now, the typical response would be put them on a blood pressure medicine and give them a medication for erectile dysfunction. That's perfectly fine. But in many of these cases, if we simply reboot the nitric oxide availability, the blood pressure will normalize and the sexual dysfunction will go away. Right. And so we're able to use a salivary test to assess that nitrite status. Is this pathway for nitric oxide available? Now, if it's a 30-year-old and they're very fit and very healthy and they don't have any chronic conditions, they probably are producing pretty good nitric oxide through their NOS enzymes. Again, something we can't directly measure. But as people age, then that NOS system becomes increasingly compromised. At some point, it gets what's called biochemically decoupled. And at that point, it's really not working at all. And if you try to preload it with nitric oxide preloaders, you actually create oxidants rather than antioxidants, because nitric oxide is an antioxidant. So this is really critical. But the one pathway that's always available is nitrite. And what we historically did is we took nitrate from the foods that we ate, and we converted it in our oral biome, a healthy oral biome that has nitrate-reducing bacterial species, into nitrite. And that nitrite drops down into the gut, where it's actually very beneficial for the environment, the gastric environment and the health of the gut, and also beneficial for your gut biome, but also becomes the source of nitrogen for nitric oxide production. And so studies have clearly demonstrated that if we optimize nitrate, nitrite, nitric oxide, then the system will stay online. And not only does it stay online, but it actually improves NOS activity as well. So now you're getting the benefit of both systems. But essentially, this is a 50-year-old female. She's got elevated inflammatory markers. She's got some fatigue, and she's nitrite depleted. So we could assume that probably nitric oxide support is pretty critical for her. So in this particular case, we initiated nitric oxide support. We're going to tell you how to do that later. I did also introduce glutathione because her glutathione levels were very low, and we boosted nutrients because she was nutrient insufficient, including essential fatty acids and amino acids. She wasn't eating enough protein. And I did actually use a specific peptide for post-COVID inflammatory syndrome. And our follow-up evaluation revealed complete normalization of the inflammatory markers. Subjectively, all of the brain fog, trouble waking up, exertional capacity shifts, all of those were resolved. She was back to normal. So I know it's a little bit busy to see this possibly through a screen, but this up here is the initial blood set where you can see the high sensitivity C-reactive protein is 14.5. That is really, really high for an individual, but also her, whoops, how do I go backwards? There we go. Also, her fibrinogen levels, meaning endothelial inflammation, endotheliitis, were elevated, and her interleukin-6 is elevated. And then we go forward after we've run this protocol, optimizing nitric oxide plus some other things, and you can see interleukin-6 is now optimal, fibrinogen is now optimal. CRP is back in the normal range, not quite optimal yet, but this was just within 5 weeks of addressing this protocol. So it's a really nice decrease, and about 6 weeks later, her nitric oxide was optimized and good. So we see this significant improvement in the inflammatory environment of the body in this particular case very rapidly, which subjectively the person had a notable improvement in how they felt. The next case study is a 70-year-old man who was healthy and into longevity. And he asked his doctor for a coronary calcium score, and it came back at a 970, which is a very high score. The guy had extensive atherosclerotic plaques. He had no idea. He's like, what's going on? What happened? So he came to see me to help us, to help get more information about his endothelium and what were the variables impacting his arterial health. And he had a number of them. He had, very high levels of ApoB and small dense LDL. He expresses lipoprotein A, which greatly increases your risk of atherosclerotic disease, had a very high level of homocysteine. And then he, of course, was pre-hypertensive. He also had an elevation in oxidized phospholipids, which is a marker for oxidative stress at the level of the endothelium, amongst other things, and an elevation in CRP. And he was depleted in nitrite status and also reported mild erectile dysfunction. So here's a guy who's found out that he's actually got coronary artery disease. He hasn't had an arterial event, and he's got all of these various influencers across, that are influencing a pro-atherosclerotic state, meaning an active plaque forming state. And nitric oxide is one of the most critical in this particular case. So we introduced a regimen for him. He was not willing to consider cholesterol lowering medications for his own reasons, and so that was not part of what we did here. But we introduced nitric oxide support along with other things to improve the clearance of homocysteine, improve cell membranes, and his follow-up, his blood pressure was under 120/80 consistently. He was also checking it at home, and the numbers were very good. There was a notable drop in baseline blood pressures. His erectile dysfunction had improved, and then we saw normalization of the oxidized phospholipids and the other biomarkers. So again, kind of busy, but you can see over here this oxidized phospholipid 20. that's a crazy high level. Like that's a big problem. And then you can see some of his other lipid markers over here as well. And looking at cholesterol production, cholesterol absorption, trying to better understand his lipid cycle. But, the main thing is the elevation in blood pressure, the ED symptoms, and this heavy oxidation of lipids on his lipoproteins. And then at follow-up, you can see the oxidized phospholipids. There's actually two intervals here. There was the 6 weeks and then 12 weeks. You can see the oxidized phospholipids dropped from 20 to 7.5 and then dropped down to normal at 1.9. So this completely cleared up. His lipid profiles improved. The homocysteine optimized. We, were able to see some substantial improvements in lipid ratios and lowering of ApoB over time without using cholesterol-lowering medications. In this particular case, I would have recommended it for him because of his lipoprotein A, but he did not want to do that. But we also measure we use a device to measure carotid intimal medial thickness, which will show us whether or not there's really active plaquing going on as the endothelium under stress. And this guy's IMT at baseline was really high. Like not only did he have the old plaque on the coronary calcium score, he had new plaque. He was in an active plaque forming state. And 6 months later, his IMT had normalized, meaning that the atherosclerotic process had likely been aborted, that he was now stabilized, the plaque could heal, and hopefully he would accumulate no more. And this was a couple years ago, and he has continued to have normalization of these markers and stable IMT. So and he has had no progression in the coronary calcium score. His numbers have remained the same. So that's a big win. And in his particular case, I absolutely know that the nitric oxide support made a major difference in these outcomes that we're measuring. And then the last one is a 40-year-old male who came in to see me, and another person, physically fit, feels good, want to plan for health optimization. He just drinks. He doesn't drink alcohol every day, but when he drinks way too much. Initial evaluation, borderline blood pressures, high triglycerides, once again, oxidized phospholipids, elevations in inflammatory markers, oxidative stress markers, uric acid, and again, a 40-year-old fit guy, but depleted nitrite status. Very similar, started on nitric oxide support, full spectrum essential nutrient support, glutathione support, especially with the heavy alcohol use, and really worked with him on reducing alcohol. And at our follow-up, we had normalization of blood pressure, improvements in lipids and triglycerides, major reduction in the oxidized phospholipids, the ferritin, uric acid, homocysteine, and inflammatory markers. He had a notable improvement in mental and physical energy and his stamina for fitness. And he was tracking his sleep data, and we saw big improvements in deep sleep, sleep efficiency, and REM sleep. Now, during this phase, he minimally reduced his alcohol consumption. Later, I'm glad to say now, he's greatly reduced it. And so many aspects of his health has improved. But the improvements we saw here, he really didn't change alcohol consumption. So once again, you can see the metrics. We have the high oxidized phospholipids, the elevation in interleukin-6, the high triglycerides, others, elevations in small dense LDL, the ferritin level of 349. You can see here the follow-up ferritin dropped to 125. All right, so that's a pretty significant reduction. Homocysteine from elevated 11.4 to under 10. And then uric acid levels from 8.2 to 5.6. And his original CRP is not listed here. It was elevated on that last lab set, had dropped to optimal. This also just shows his glutathione status that was low and did improve subsequently on follow-up checks. And you can see his interleukin-6 is normalized. His oxidized phospholipids aren't quite all the way home, but remember, he's still drinking alcohol, but they are substantially reduced. Triglycerides have normalized. Small dense LDL has dropped considerably. So again, a lot of improvements across a range of metrics for him. I know that was quick to walk through these case studies and that there's complexity to them. The big theme is that you had these individuals, they were all over 40, one's 40, one's 50, one's 70. All of them tested very low for nitrite status. All of them had various factors that were likely influencing their nitric oxide production capacities. The 70-year-old just based on age, the 50-year-old based on immune dysfunction and inflammation, the 40-year-old based on oxidative stress from alcohol use. And two of the cases, we see evidence of endothelial dysfunction with borderline blood pressures, ED, and the older man, and we're able to measure it in some blood studies as well. And, and again, I'm not saying that all we needed to do was fix nitric oxide and then just let all of this play out. We had other strategies to address their health issues, but nitric oxide was a critical one. And had I neglected this keystone molecule, I'm not saying we couldn't have seen good results with these patients, but we would have missed a big player in how that human system can improve function and resolve dysfunction. So, for people who are interested in looking more deeply into their patient system, this is not comprehensive, but these are ways to get more information. You can look at markers of oxidative stress. Some of these are a bit indirect, but you can kind of infer where a system is. You can look at markers of inflammation. You can do endothelial studies like endopat or carotid IMT and blood pressure surveillance. And you can look at metabolic health markers. And most importantly, for nitric oxide, you can do a saliva nitrite test to determine, is that person at least does they have at least have that one system of nitric oxide availability optimized so that they can maintain this important molecule. So that's the foundation, and I know there's a lot of information, and this is just a short webinar. We could do hours upon hours of looking at nitric oxide, all of its biochemical mechanisms, all of its impacts on cognition, brain health, mitochondrial performance, cell membrane integrity, gut biome, and metabolic health, and the list is just really mind-blowing, all the potential benefits. But we don't really have time to do all that today. I'm hopefully establishing that most human systems that you're encountering have these kinds of health challenges going on within them that are going to result in disease that they haven't already, accelerated aging, and if you're an interventionalist doing procedural work in someone's mouth, going to result in slower healing rates and also the type of healing that occurs. So it's critical in that while as a health professional, or it may take you some time to build out a more comprehensive model around human systems. One molecule that you can address right away that actually affects all those systems is nitric oxide. My patients always ask me, because I have access to all the therapeutics and peptides, like if you put me on a desert island, what would be like my top 5? And I'm 55 years old now. Right. And so, and I don't have great NOS and enzyme genetics. And if you put me on a desert island based on all the study that I do of human health, human design, longevity, disease, all the thousands of patients I get to treat and assess, what would be the 5 things that I would pick? And one of those 5 is nitric oxide support. It's like a daily for me. I travel with it. I don't skip it because it makes a big difference for me in nitric oxide availability. My blood pressure stays normal and low. My exercise capacities stay higher. There's a notable difference. So if you, and the reason is that if you had to live for a long time on a desert island, there are just certain things that you can make sure your body has that is going to allow it to do so much better at staying alive, staying healthy, and defending itself. And nitric oxide is one of those keystones. So how do we address this in a medical practice, clinical practice, dental practice, or just for ourselves? The first thing is you want to build up nitrates. Like you have to have the nitrates in order to get the nitrites. Historically, you could do this by, eating nitrate-rich foods. Here's a list of them: arugula, beets, bok choy, spinach. Now, here's the challenge. I still recommend people eat these foods, but I don't recommend that they eat inorganic versions of these foods, because if they're being grown on conventional farms, then they're covered up in glyphosate and other organophosphates and often contaminated possibly with heavy metals. Like it's just a high toxicant burden. At the end of the day, you don't want your nitrates with a bunch of toxicants. So then you would say, well, let's go with organic, which I agree with. So eat more of these organic foods. The only challenge there is depending on that organic farm and the nitrogen concentration in their soil, because they're not going to use, if it's an organic farm, they're not going to use nitrogen-enriched fertilizers. And so sometimes the organic sources of these foods simply don't have the nitrate concentration, but we would still want to improve nitrates through our diet. Now, the method that I use and I recommend for all my patients, where I believe it's time, you need this intervention, again, based on health, based on age, potentially based on genetics, but you don't have to have genetics to make those decisions, is why don't we just go ahead and cover the nitrates? Yes, I still want you to go eat organic beets and arugula and bok choy and spinach because there's other things that are good for you, but we can't count on that giving your body the level of nitrates it needs to optimize nitric oxide availability. So why don't we just go ahead and put that into your body? And so I've used a lot of products over the last 10 years for this purpose, and all of them have been potentially helpful. But what Berkeley Life has, from my perspective, and this is my own opinion, but I spend a lot of time in this space and I know the products on the market, they have the best product to solve this particular challenge because it's the long acting, the longer half-life, the combination, the actual dose of the nitrates is sufficient for most individuals to go ahead and optimize nitric oxide availability. So if they take 2 capsules a day of Berkeley Life, and hopefully they get some dietary nitrates through healthy sources, they are likely going to measure that nitrites are optimized. And then you can infer from that nitric oxide capacities are at least normal and probably optimal. Okay. So, this is getting into some of the other options for nitric oxide. So a lot of the pre-workouts will have arginine and citrulline. I think that can be good, but the problem is that if your NOS enzymes are decoupled or not working well, as we mentioned earlier, the end result of this is peroxynitrites instead of nitric oxide, which is actually creating more harm. So I will still have my patients use nitric oxide preloaders pre-workout, but only after we've optimized the nitrate-nitrite pathway. Then I know NOS is going to work well and we can get the benefit of both systems. Beetroot can be a good source of nitrate. Again, it's about the soil quality. Where was it grown? It's also difficult to actually be able to measure and to determine what your effective dose is. And it has a relatively short half-life as well. And then you have a lot of fast actings that could be used, say, pre-workout, but they don't provide that coverage, that extended coverage throughout a longer period of time to really make sure that the body is maintaining healthy levels of nitric oxide at all hours of the day and night. Now, there are things that we can do that will improve our own nitric oxide production in our body, including exercise. Exercise is critical. Fitter people have better nitric oxide levels. Deconditioned people likely have the decoupling of NOS and are really compromised in this way. But conditioned people will continue to entrain that system into a more optimal state. Breathing through your nose and breathing properly enhances nitric oxide production. Getting adequate sleep, stress management, avoiding smoking, vaping, reducing alcohol, right? All of these things play a role. These things play a role in all aspects of health, but they do impact nitric oxide. But optimizing oral and gut health is critical because there's a key step in this nitrate-nitrite process for it to work and end up resulting in the nitric oxide. So then we want to build, meaning we've established a habit matrix and a source of nitrates. So we actually have the ability for the system to work for us. And now we want to make sure that we're optimized. There can be too much, right? And there can be, too little. So what we use are the saliva test strips that just assess nitrite. You just put them on the tongue for 5 seconds, pinch the 2 ends together, and then you look at the indicator, and then you index that against a little card that tells you whether you're depleted, low, at threshold, or optimal, or high, right? So it's really easy to assess. But the other thing that we may see, for instance, the typical process is the patients come into our clinic. I'm just getting started with them. I see through my metrics and through my understanding of that patient that nitric oxide is probably something we're going to definitely want to make sure we're accounting for. We run the salivary test. My staff already run that. It's just like every other test we run. They already run it and they set the strip down on the table so that when I come in to meet with the patient, it's there. Then if that individual is going to benefit from nitric oxide optimization, I will start them on Berkeley Life 2 capsules a day. And then typically within 2 weeks, we should measure that they're at optimal, maybe a threshold, but typically optimal. And so we'll send them home with some test strips so that they can check. And if what's happening at the end of 2 weeks is there's really minimal change, it's not happening, then we know that there's an oral dysbiosis. that they don't have a healthy oral biome that's capable of reducing the nitrate to nitrite. Okay. And so we already tell to patients about this at the time of our initial visit. So we're not waiting until they are demonstrating they're not responding to the intervention to do this, but we tell them, you need to avoid antiseptic mouthwashes that are harmful to the oral biome, fluorinated toothpastes, drinking fluorinated water, to overuse of antimicrobial agents, which obviously has an impact on our oral and gut microbiome, toxicants in foods, dyes, and flavor additives. These things have an impact on the health of the oral biome. I think you probably know that better than anybody, and that will end up influencing not only the health of the body in many ways and nitric oxide in many ways, it'll directly influence the ability to use this pathway for nitric oxide optimization. And it goes beyond this. Taking antacids and changing gut pH also influences outcomes in these particular cases. So we really try to minimize people's need to use antacid therapeutics, to use these oral care products that have astringent molecules and toxicants in them, and really like reducing the health of their oral tissues and their oral biome. And then, as we balance, we continue to encourage the consumption of organic, nitrate-rich foods, but also we could begin to include prebiotic and probiotic-rich foods and increase polyphenols to potentially boost overall biome health. As we know, there are a variety of polyphenols, olive extract, garlic extract, pomegranate extract, and many others that have potential benefits for the oral and gut biome. And then there are prebiotic fibers, inulin, and others that also help grow up the healthy good bacteria. And then if what we see, though, is that they're not converting and we're a couple weeks out and we've made sure they're not using the mouthwash and that they're not just like trashing the oral biome or taking antibiotics around that time, what we can do is we can actually introduce this prebiotic nitrate chewing gum, and we'll have the patient use this typically within a couple of weeks. What we see is they've repopulated the nitrate reducers, so their oral biome has become healthier, and now they're converting, and we can actually measure the nitrites on their strip. So it's really an ingenious process. When I first got familiar with Berkeley Life and got introduced to their product, we didn't have this prebiotic chewing gum. So people who didn't convert, we just tried to help coach them on the lifestyle and hope that maybe they could repopulate a healthy oral biome. But most of the time we weren't successful. These were individuals that we weren't able to actually ever able to optimize nitrites. But when we began to be able to introduce the chewing gum, the prebiotic chewing gum, it was a game changer. And now patients who aren't converting, we know we can go ahead and do an intervention and make sure they're not doing the things that are very damaging to the oral biome. And we can improve the health of the oral biome and get the benefit of nitric oxide availability. So also just extra things about oral health, dietary nitrates are a prebiotic to the oral microbiome. Dietary nitrates and converted nitrites play very important roles in the balance and health and diversity of our holobiome, not just our mouth and our gut, but also our skin. So bathing the mouth in prebiotic dietary nitrates for extended periods allows that oral microbiome time to engage and respond, and then ultimately can produce the end result we're looking for. And then we just kind of make sure that people stay on this path and they continue to optimize nitric oxide availability. It becomes automatic. Like and we've covered a lot. There sounds like there's a lot to do. Really, there's not. The things that everybody needs to do to be healthier: eliminate toxic foods and toxic personal care products, eat whole organic foods, optimize nutrient availability. I mean, these are minimize tobacco and vaping and alcohol and stop taking antibiotics every time you get sick. Everybody needs to do that for all kinds of reasons. But otherwise, what we've done is simply taken the people who we think, based on age or health, need this optimization. We've put them on 2 capsules a day of a product that they take. And once we've assessed that and we get them to goal, we're like, great, now you're just going to keep taking 2 capsules, and maybe once every 3 months, do a quick test and make sure it's still working. And it typically is. So it goes on automatic pilot. Or if we don't see conversion, we do a little counseling around the oral biome and we put them on the prebiotic chewing gum. Then they start converting. And then we just continue on. They don't keep chewing the gum. We just carry on and they just keep taking the 2 capsules a day. And it takes care of things for them. And they maintain nitric oxide and they reduce the likelihood of poor health outcomes based on nitric oxide depletion. So this is, of course, more. Berkeley Life also has a couple of other products. They have a skin serum, which enhances nitric oxide to the skin, and they have a botanical-based cognitive support. I will tell you, this skin serum is awesome. It's incredible. It really works great for acne. It can help substantially reduce the inflammation associated with acne and help skin clear up a lot faster. It's also a very powerful anti-aging strategy for the skin. So I've pretty much already described this for you, so I'm going to wrap up and let you answer questions. But this is a process, and of course, you have access to the slide. This is what we do in our own clinic, so that this is just automated. I even wrote up a little PDF document explaining the why and everything for the patient, so they could go back and remember, why is this so important, and why are we doing it, and how do we do it? But essentially, we already have in our rooms the test strips and the scaling cards. The nurse, the clinical assistant, is going to go ahead and test everybody that comes in. They're going to test everybody. I'm going to do my evaluation and make a determination based on age and health factors whether we need to intervene for nitric oxide. And then we introduce the Berkeley Life product, potentially the chewing gum if needed, and we make sure they get optimal, and then we just make sure they stay optimal. And then we can just say, we check the box on this one. Got a lot of other things to work on, but we know that the nitric oxide availability has been optimized, and that's going to make a big difference in long-term health and across all these different domains of health. So this is a patient selection side. Again, it gets into some of the nuances of how we make these decisions. These are available for you. I actually helped write this slide based on our own kind of algorithm for how we're going to do this. And so you can have access to this and use this as a resource tool if you wish to, for determining, how you would like to, how you decide who you're going to test on. If it's a super healthy, fit 25-year-old that comes to see me, which isn't often because they're not usually investing in intensive optimization programs, I'm not going to test them for nitric oxide. Presumably a healthy, fit 25-year-old, their NOS system is working just fine. So we don't have to overdo this either. It's about being intelligent about how we select. And then they do have a code for discount that Berkeley Life is offering for this attendance. And they have a really good clinical model for clinics where we're able to buy it at wholesale. So we can just go ahead and distribute directly to our patients, but they can also then auto ship through the Berkeley Life site using our clinical code. And so that's been really helpful for our clinic and, keeping this very easy for the patients to be able to stick with it. I found that going ahead and presenting them with a box in clinic just enhances compliance because it's really high on their mind because they've seen the test result. They've heard how important this is, and they're willing to actually go ahead and say, hey, I'm going to do this. And they can get started. And then in 2 weeks, they can already do a repeat test and see that they're getting the benefit from it. So that's the end of the presentation piece of this. Again, I know a lot of information quickly, but hopefully you get the big picture. There's a keystone molecule called nitric oxide. It plays a role in all domains of health and healing. As we age, it gets depleted. If we have health conditions, it gets depleted. We have a way of optimizing it that's natural and beneficial and will not cause harm and can make a big difference in health outcomes.
Awesome. Thank you so much. We do have a couple questions. Would
Sure.
you like? Okay. So let's see. The first one I got one from, I think you already got one. Oh no. Okay. So, okay. So Stephen Thomas said, could you explain more on producing NO through dietary pathways? Right. How producing NO through the dietary pathways improves the NOS enzyme, I believe. I think you touched on that one a little bit. I didn't know if you wanted to
Yeah,
elaborate further.
it's a complicated biochemical paradigm, but essentially the NOS enzymes become, as we age, or based on health factors, they become biochemically decoupled. And so they're not ending up creating the end result, because it's a sequence of enzymatic transactions that results in the nitric oxide. And when you begin to produce the nitric oxide via nitrate, you have a recoupling of those enzymes, and that system reboots and begins to perform again. Again, you get into some more complex biochemistry to explain it in detail. There is there's a series of lectures on the Berkeley Life website that get into the genetics and biochemistry in more detail and could help you understand that pathway if you'd like to understand it better. So those learning resources are available.
Awesome. Okay, so on food labels, we often see no added nitrites and nitrates. I see a lot of things like salami or pepperoni. Can you can you speak on that? And additionally, potassium nitrate is a common ingredient in toothpaste. Is that helping our NO status?
You know what? I didn't know about potassium nitrate in toothpaste. That's really interesting. I don't know what the dosing of it is, but my opinion of it would be, yeah, absolutely. It's going to add to the total nitrate pool available for creating this conversion. So I'm kind of curious, why is it in there? Is it a natural
True.
toothpaste know about nitric oxide, or does it play some other role? So that's interesting to me, but my somewhat educated opinion would be, yeah, but it's just a matter of how much is it, right? Does it equivalent to the dose, or how much of a dose does it account for? And then when it comes to the, say, like cured or processed meats, so historically nitrates or nitrites were used as a protective agent, right? And then there was a real concern around, is there an increased risk of cancer associated? And is it the nitrate or nitrite that's increasing that risk? There's a buffering process with ascorbic acid for nitrates or nitrites that actually reduces the potential chemical oxidation and the potential carcinogenic risks associated with that. And so that's why you'll typically see on meats that were packaged with nitrates or nitrites that they have ascorbic acid added. You also see on the Berkeley Life product that ascorbic acid is one of the ingredients, right, for that very purpose. But that became a food labeling thing when when there were a lot of pop culture headlines saying, hey, these could be carcinogens. And there are aspects around processed meats, preserved meats, where there are various chemicals, and sometimes the animals weren't that healthy, where there are potential health risks associated. But the natural curing processes, the ancestral curing processes, don't appear to have that associated. But if it's if this is a food producer that's actually really conscientious about toxins and the health of the animal, and then they've added, for preserving purposes, some nitrite to that, and they've buffered it with ascorbic acid, that's actually good. That's just another source of nitrate, just like a potassium nitrate in toothpaste. So you can actually get, like, if you were to go look up high nitrite foods or high nitrate foods, for the purposes of saying, I want to fix this through food, you'd find hot dogs on the list. Right now, I'm not going to recommend people go choose traditional hot dogs as a way of getting this done. But so the reason that some of the vendors decided to eliminate that from their packages was because of the concern around it being a carcinogen, which honestly I believe was overblown. If you use the right process, it was not.
Cool. Thank you. That was awesome. Kathy did say that potassium nitrate in toothpaste is used as a salt. So that's super
Okay.
interesting.
Yeah, it
She
isn't.
also sent the question, what are the most common genetic SNPs you see that contribute to NOs, uncoupling? I'm sorry if I said that wrong.
I can tell you that. It'll take me, whoops, hold on one second. How did I just end up back in my slideshow? Sorry. Hold on one moment. But um, I don't commit to memory all the genetic polymorphisms because I have to preserve my working memory. But I can tell you very quickly,
Sounds good to me.
yeah, what those are, because I can just simply pull it up on the report that we use. And yeah, this guy's name isn't on here. So I can show you actually, and you can take a screenshot because his name is not on here. So I'm gonna go back to my meeting here. Boom, 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 boom. All right, here we are. So this is what the screen looks like for nitric oxide. And so this individual obviously has a pretty ideal NOS system, but still by age 60, it's probably not going to work well. Or if he's sick, overweight, has metabolic dysfunction. So you can see right down here, these are the actual genes that we're assessing for. And then obviously this is his genotype. So we have these NOS3, 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 NOS3. And then, we have, for me, I have a guide to understand which specific alleles are the ones that potentially hit expression. But this, if you want to take a screenshot of this, these are the genes that you're looking at. Of course, the individual analysis depends on the specific genotype of that particular patient.
Give everyone just a sec. Well, I think the last question is, they just want to clarify, what is the test called that if they need they need to take when needing gum? So the chewable gum that you talked about.
Say that, sorry, repeat the question for me.
So they just want to clarify what the test is called when they need the gum.
Oh, so that's the same test. It's the nitric oxide it's the nitrite salivary test. Okay. That was on the side of the little strips. Berkeley Life sells these. And essentially, if the person comes in and they have really good nitrite levels, we're not intervening. And every so often I see that in individuals, even older individuals, that they don't need any intervention in this pathway. But if it's depleted, which you'll commonly see, then we intervene with the capsules, right? We go ahead and have them start taking the capsules. If they really want to try to do it through their diet and see if they can get there, I let them. I tell them which foods, make sure they're organic, and just keep testing and see if you can do it. But if you're not getting there, we need to address this. And so, and some have found a way where they can only take, they can do it through their diet plus one capsule, right? So as long as we're getting to where we want to go, it doesn't really matter to me how it's getting done, as long as the foods aren't full of toxicants. So they take the 2 capsules a day, and 2 weeks later, they're retesting, and they're still just completely depleted, right? There's no movement. So it's the same test. It's just showing that providing these nitrates is not resulting in measurable nitrite in their saliva. So if that's the case, then you know that it's a oral biome issue. And that's where you then intervene with the chewing gum to reload to grow those nitrate reducers. And then you retest and with the exact same test again. And hopefully you're measuring that you now have detectable nitrite levels. Does that make sense? That is,
I mean, at least to me, to someone who's not a physician, I
yeah.
follow
So
that.
it's the same salivary testing strip for nitrite that you use for initial assessment, for whether or not you're getting the result you want, and then to reassess if you needed to intervene on the oral biome.
Perfect. I think that's all the questions. If nobody has any last minute ones, then I'm going to put up our final slide. Okay. And say thank you to everyone for joining us. Thank you so much, Dr. Vickery, for your wonderful presentation and all of those wonderful questions. I feel like nitric oxide is something I had no idea about, and I'm so happy that a lot of people who want to speak for AAOSH are invested in it. So thank you so much. Thank you to everybody watching. If you'd like to claim CE, you will use either the code that I posted, or this URL you see on there, or you can scan the QR code. You have about 7 days to claim it, and then it will be no longer available. Any final thoughts, Doctor?
No, I'm very grateful for your time and attention. I think to me, it's the greatest privilege when whether a health consumer or fellow professionals take their time and let me share what I'm learning in my clinic. And I appreciate it when those that can teach me do the same thing for me. But I consider it a great honor and privilege that you would take the time and allow me to present this to you today. So thank you very much. And thank you for the work you're doing, because all of us together, we've got to change this health trajectory in our country.
Absolutely. And on that note, thank you so much, everyone. Have a great day.